Hi, Scott.
Hi, good morning, Kristen. Can you hear me okay?
Yes, I can.
All right, there we go. Yeah, I had a original mute there. All righty.
It looks like we're just waiting on your moderator.
Okay, no problem. And then we wait till 11:30, correct?
Yes, yeah.
And then are you going to switch over control because I have my presentation? Is that right?
You have access.
Oh, I have access.
Yeah,
Okay.
I have nothing locked down. The only thing I had set up was just the recording and the waiting room.
Gotcha. Sounds good. All right. Is my slideshow showing right now?
It is not.
Okay.
All right, here's Andrew. Morning, Andrew.
Morning.
Or afternoon, depending on where you are.
I got about an hour, then it's afternoon.
Okay, I was gonna say it's 12:15 here, so.
Hi, good morning, Andrew.
Morning.
And Andrew, do you have the AIA code?
I do not. I just have my script.
Okay, let me pull that up.
Hi, are you seeing a presentation slide now?
Yes.
Yep.
Okay, sounds good. It's just the slide, correct? You can't see a notes section pane?
No.
Nope.
Good.
Just your slide.
Perfect. I'm ready to go. So
All right, so there's the AIA code. So right at 12:30, I will admit people in from the waiting room,
Okay.
just so you guys have a heads up. So you'll start seeing more people populating.
sound good.
Okay, you guys have about a minute, so I'm gonna start letting people in.
Okay,
Sounds good. Thank you. Final check on audio. Does everybody hear me okay?
yep,
Yep,
I
you're
gotcha.
good.
Okay, thanks.
I'll monitor the chat throughout this too, in case any questions pop up for you.
Fantastic. Yeah, definitely gonna encourage that questions. All right, perfect.
I'd like to welcome everyone to APA's virtual facility symposium in today's session entitled Campus Partnerships, Collaborative Efforts. My name is Andrew Mott, Senior Manager for Building Maintenance from Iowa State University. I'll be serving as your moderator for today's program. Allow me to review a few housekeeping items quick. All attendees should be in listen only mode. During the session, we'll utilize the chat feature for engagement or any AV issues. As a reminder, we'll be recording this session and posting it to our event site at the conclusion of the event. For attendees seeking AIA credits, please follow up with Billy at billy@appa.org. Be sure to reference the AIA code, which is already uploaded into the chat if you need it. And certificates for CEUs, PhDs, and LUs will be sent to everyone on October 31. It's now my pleasure to welcome Scott Bush, Assistant Director of Trades Safety from the University of Illinois at Chicago.
All right, thank you, Andrew. I really appreciate that. A little bit about my background. I'm 20 years, close to 20 years into industrial hygiene and mainly health and safety. I specialize in occupational safety, so that's going to kind of be the mindset of where I'm coming from. I don't know if anybody caught the keynote today, but Dr. Jolly ended with a beautiful song. His address was amazing too, but I can promise you all that I won't be singing to conclude the presentation because I won't torture you as much as I would love to. I won't be doing that. I'm very envious of people that can sing, but I definitely cannot. So that was a treat. He did a really good job. And furthermore, as we conclude our conference here on the last day, I'm also participating, and I saw some excellent presentations, really, really good ones. And so I hope that I can be informative and we can have a good discussion, and I can be concise for you all attending. One of the ones that I definitely want to promote if you weren't there was I'm getting too old for this. I believe it was the director of facilities for University of Oklahoma gave a great presentation with her HR director on managing a diverse aging demographic and what they're going to do forward in trying to retain knowledge that is leaving and manage that organization and even imaging and rebranding facilities management. It was a really, really good presentation, so check that out as well. Without further ado, I'm going to talk to you all today about campus partnerships and collaborative efforts. We're going to focus on some lessons learned, some stories behind those lessons, what the collaboration looked like, but really what came out of those and how we're implementing those same lessons learned looking forward into the future, and we'll be doing that. And these are all focused on the pandemic and the changes during the pandemic. So I also really, really, really want to encourage everybody to speak up via chat. I don't really even mind if you unmute. I know that's kind of they want to steer clear of that, but anything you have to add or questions during the presentation, I like it to be a discussion format if you're comfortable. And I would, we can go off on tangents and steer back. It doesn't matter. So I welcome that if anybody has anything to say, and Andrew will help moderate and he'll be watching the chat. So please feel free if you're comfortable or you want to speak up, do so. All right, we'll get started here. So thinking about campus partnerships and collaborative efforts, the root of when positive things happen, especially during the pandemic, was, when people came together, built relationships, and worked through problems. And here we had the lessons learned and the outcomes, and we can learn from those as we move forward. So the topics that we're going to discuss is, health and safety reimagined, facilities maintenance, creative use of space and logistics, just to name a few. There's broad teams made up of campus leadership in healthcare, safety, facilities management, project management, campus auxiliaries. All those groups came together and to innovate new ways to manage campus during the pandemic. And again, there was some of these outcomes I really feel like we're going to be able to use in the future. And that's what, we want to present today. Again, there's so many collaborations and, to mention, and I'm just going to do my best to highlight over the next 45 minutes or so, what went well and the positive outcomes. And I know things were very difficult, and there was a lot of, trip ups during the pandemic, and managing it was hard, but I truly feel that some amazing things came out of it. And, we'll discuss those as we move forward. All right, the first thing I like to talk about is, from my perspective and kind of what changes on a broad level, for the first time in my career, and I know especially other folks that focus on occupational safety, workers, maintenance, and things like that, is that we were for the first time dealing with health as the main hazard. Same with even healthcare professionals, their routines were changed because we were at a global pandemic and new procedures and new operations had to come into play. And so they had, a really big focus to change their operation and things of that. And they were also called upon, along with, health and safety professionals, as folks to lead, charges and what to do during this pandemic. As that mindset focus, I can give you an example. My day-to-day may involve a lockout, tag out. And so let's say there's an electrical hazard. I know where that electrical hazard's coming from. I know the procedures needed to isolate that. I know the singular person to call upon to help me with that. It would be an electrician. So they would come and isolate this and we would solve that hazard. The difference with the pandemic is the hazard is everywhere. And you need to call upon everybody to help out. And that's what, we want to talk about today, those collaborative efforts and, and solving that problem and that mindset shift. And I think going forward, I really, really understand how helpful working with many different groups, even on singular problems, can enhance that. And that's kind of the main message today. So the first group I want to talk about is transportation and logistics. The question is how do we safely transport student staff and protect our drivers? We, implemented new, if you can see the bottom diagram, sorry, it's a little small, but it's basically just respacing people carriers, making sure social distance standards were in place and things of that nature. We even had to install aftermarket polycarbonate types of divides, sneeze guards, and things of this nature. And, looking to trades and manufacturing to collaborate with on getting good input in here. They had to collaborate, healthcare professionals, all these met that theme of collaboration. Also we had to deal with how do we sanitize these spaces, and how did we get these things cleaned, and using different types of equipment, non-contact sprayers and things that took the folks out of it. And, looking to our healthcare professionals again to collaborate. How do we clean ambulances? What protocols, procedures did we use to make that happen, and try to implement that to the transportation and logistics teams managing this situation? And, one of the stories that stuck out with me on collaboration, it kind of was outside, but it was brought back internal. Our provost at the time, who again, very, very intelligent lady, but her expertise was in education and managing campus education specifically. But she had the wherewithal to recognize early in the pandemic to reach out to a contact and invite herself to a high-level meeting with the Chicago Transit Authority to understand what they're doing logistically for their people. And they had, CDC representatives and other health and safety and government officials, infectious control there. And she brought that back to us, to our transportation, with those protocols and procedures, and made those links. And I thought that was just an amazing display of leadership and taking those opportunities and thinking outside the box and collaborating to make things safer. And that kind of set the tone on the work we did for the transportation group, and working together to start off that part of the pandemic. And again, our transportation group was hit hard during the pandemic. Not only did our drivers suffer a lot of infections, but we were moving people in the uncertainty, and all this teamwork helped really calm that, and we really got to a good place. And then, so that was a really, really cool thing about that. So, looking into the future, our transportation team had to focus on logistics. That brought in a lot of communication with contact tracing, housing, all the units. And not only the cleaning techniques we'll definitely use in the future because they're efficient, cost effective, and keep the people out of harm's way, we also learned that, from the principles of contact tracing, that logistics can be enhanced. And it's really good to know where and when and at what time, our units are at. So we upgraded during the pandemic and are continuing to use mobile tracking GPS and better systems and better software that creates more data that will further enhance our safety moving forward. We're gonna be able to, again, have real-time data that focuses on, efficiencies, where there's high use, where there's pedestrian interfaces that we can find through camera systems. And you can imagine we can send out notices on high traffic areas throughout campus, so we can get them notified to drivers as well as campus faculty and staff where to watch out for when crossing the road. And there's just, the sky's the limit on these new technologies that we learned from the pandemic. So we're super excited about that data that's coming in and how we can use that to enhance our service to the university and our business, and being cost effective and efficient. again, so it's, real-time routing, safety, and those things are the big thing to be, reiterated with these tracking efficiencies. And so kind of giving you a screenshot to further see is that, the mapping screens, have all kinds of data applications, and then the cameras, high def views, front and back. And again, to reiterate, this will protect not only, our drivers, accidents, near misses, and then of course our precious, folks out on the roads, whether they are affiliated with the university or not. We do live in a downtown campus, which we'll, talk about those challenges. So this is very important to us. All right, the next group, space management. How do we safely and effectively provide an in-person learning environment as part of a hybrid learning system? So again, we chose to do a hybrid learning system for our campus. There is a lot of focus on in-person learning. So those parts of the pandemic, or that part of the pandemic, was the challenge is how do we bring not only, our students, but our faculty, staff back into these spaces safely. And again, this is going to be kind of like a broken record, but the collaboration was heavy. Health and safety, classroom, management, the planners, the schedulers, everybody had to be involved. And not to mention the teachers too, on training to manage these classrooms. There was social distancing protocols put in place, mapping. Our planning team used all our maps to calculate occupancies and things of that nature. So it was really, really a collaborative effort to get those set up. So, one thing that, as a lesson learned and looking forward, some of our spaces were, very difficult to modify, and the seating arrangements, were closed in, or the spaces were small, and we weren't able to get a good capacity for those spaces, almost rendering them unusable. So, our design team, and our project management team, I think, are going to focus on mobility in the classroom and using structures that are easily modified, not only for different configurations, but you're going through a health and safety crisis or infectious control, we can easily adapt to those. But again, if a space needs to be reconfigured, it's much easier. Lighter weight material is being used, and again, completely mobile. Furthermore, these designs were also put into, our safety supplies that, kind of coordinated with classroom management. One of the systems that we really solved a lot of problems for us is a mechanical, non-electrical hand sanitizer dispenser. So this specific unit can be adjusted to just fit a gallon of hand sanitizer. So a lot of the spilling and logistics, moving around gallons, refilling bottles, were solved by this, and we're going to continue to use this into the future. These units are mobile again. They're lighter weight, but they're sturdy, and so they can move them. So they meet that theme of what we needed during the pandemic and what we can utilize going forward to provide, sanitizing equipment and supplies to faculty and staff, employees on campus. So that was a really cool lesson learned. So moving on, and perhaps one of the biggest challenges and biggest collaborative efforts that we took on was the campus housing group and what they had to lead. We had decided, due to our proximity, we were going to house students that were infected under isolation protocols, and also those that were quarantining. You know, there was an multitude of amplified, you know, challenges in doing so, because you know, our students, faculty, and staff being located directly in the city have a lot of exposure to people, you know, just coming in, basically even in their everyday lives. One example, you know, is that, you know, we're in the heart of the city. We are located right next to all the transit, buses, trains. You know, we have, of course, all the ride sharing platforms. Our students, faculty, and staff commuting into work, or even taking a break in the afternoon, have complete access all over the city. So our exposure is, you know, is high. And, you know, to do this, basically, there's tons of concern on how do we monitor and you know, house these students and give them the information to, you know, and security, basically, to get them what they need while they're sick and recovering. So again, units involved: healthcare, infectious control, health and safety. EMS was added. This was a different one, and security that we needed was heightened. So we had to plan for all that, and the collaboration was heavy. And this was almost an everyday occurrence as we work through the problems of, you know, that we had security breaches and, you know, things of that nature. So it's detailed planning, response teams, and you know, needs to make this a successful process. One story is, you know, we were wondering what type of response and you know, from a healthcare did we need for these students. And, you know, one of the first rounds that we had for housing, we did have a student at 2 or 3 a.m. go into minor respiratory distress. And luckily we had, you know, someone on call to go to that aid and help that person. You know, this individual ended up being perfectly fine, but, you know, if that wasn't in place, we would have we could have had a really bad disaster on our hands. So they did an excellent, heroic job of getting all of these items thought about and put in place. So, you know, what is, you know, looking into the future from these experiences? You know, planning, you know, we do have all the processes and programs and information to, you know, triage students, faculty, and staff, not only in an infectious control scenario, but also in an event of an emergency. Maybe we need, you know, multiple overnights if there's some major destruction or something like that. You know, don't want to, you know, hope or, you know, worry about disastrous outcomes, but to be realistic, they happen, and we have these things in place to do that. We can train on them and carry on this knowledge. Also, you know, with these learnings, when we design spaces and reconfigure dorms and student housing facilities, there's an added focus on egress, you know, what we need for monitoring systems, how do we secure these buildings, and all the technology behind that. And I think that will be implemented into the future. So that was a, you know, a great learning. And again, hats off to these teams that had to do this. It was day in and day out. And as you can imagine, it was, you know, the high infectious rate times. This was nonstop, constant movement of students, transportation of infected and quarantining students was basically going, you know, 24/7 at different intervals. So it was a, you know, amazing thing. Another, you know, fun one that I saw is, you know, I was walking around campus and I saw all the new students coming in. So these are prospective freshmen that are enrolled coming in for their orientation, and they had their pillows with them, getting ready to start their journey here as college students and getting their education. But, we still do have slight levels of infection, and those are a concern. So I know housing implemented some of these same protocols to allow this to happen. So again, we have the safeguards to carry on moving into the future, and we won't forget, these lessons as we make sure that our students are safe. And the other point is that, we'll continue to progress the safety and well-being of our students. And that's the amazing thing. And again, dangerous times and, hazards that inevitably are in city and urban landscapes and even rural landscapes, these things can help safeguard the students with the monitoring protocols and understanding staffing, healthcare needs, and things of that nature. All right. So another very, very important work that was done was from the IT folks. The question is how do we report, track, and provide, most importantly, quick information to faculty, staff, and students during the pandemic, and how difficult that is. And, the IT folks basically had to collaborate, not only with healthcare building in this information, but each unit for their specific needs. From our perspective, from a facilities management, we had completely different needs than, our research teams. And we have one of the largest research organizations and applications at a university in the country. And so, from facilities management, we really needed health check monitoring. We needed applications to let the, a diverse demographic workforce that may not have all access to smartphones, different platforms and applications to get this information and get health checks done. And, IT inevitably provided, and that was such a help in organizing information day to day, even minute by minute, to move move in the right direction in that monitoring and control to make sure everybody's safe. Conversely, our research buildings needed more emphasis on security, on making sure that public buildings that were kind of open, highly traveled by a bunch of different entities remained secure. So that was, exterior. They used smart doorbell systems, other applications apart from the health checks to make sure that those buildings were secure and they knew who was going in and out of those. And if they did have visitors, they were provided the information to the health checks and know the protocols that were specific for that building. So, they really, really had a lot to do in terms of using that technology that we're so used to every day and enhancing health and safety in and around campus. Contact tracing was involved. And so these were very important factors of knowing, when and where people were and things of that nature. So it was really, really good. So again, moving forward with the IT folks, I really feel, and it's yet to be seen, I think we can anticipate further developments of these applications regarding health and wellness. I know we already have those for our personal life, but how those will mirror into our work life and make it better, health tracking apps and things of that nature. Also awareness and contact tracing as time moves on and those specific information. And we may even, see tracking for flu epidemics, common cold, geographies that might have high allergens, utilizing this technology, developed during the pandemic to track these things. And I feel like they did a great job of keeping information secure, working with the HIPAA laws and making sure people didn't have any issues with that. So I really am predicting good things from the work they're doing and basically positioned to help us out in how we manage business, because this real-time information is lean, cost effective, and very efficient. And those are the common things that we're thinking of. And another thing to mention is the temperature control and screening devices that were used in our clinics and even our regular facilities, and how beneficial this real-time data and that theme is moving forward, that we can understand how we will better protect the people and our organizations or universities with this technology. So again, hats off to these groups, and did an amazing job. And I think at your university, just keep in mind and partner with them and keep those relationships going so we can further develop better use tools going into the future. All right, switching gears to facilities management. Myself and these folks were here almost every day during the pandemic. And so, we got to see a lot of changes, and there's countless things that, we did. And I want to make sure, my colleagues on the presentation, that, you're recognized for, all the amazing work we did. And so, thinking about, collaborative efforts, I want to highlight a couple. Our engineering group, our utilities group, project managers and engineers worked on air handling surveys throughout, because obviously, helping air quality in spaces further helped with safety in some respects and exposure control, during the pandemic. So, we had a full revamp of these units to seeing what capacities they were running at, what efficiencies they were running at, and what our opportunities were. And we had tons of lessons learned by doing this in-depth dive, and created a great deal of data. So that was really good. And, that provided a lot of insights into the future, which we'll get into in a minute. Our housekeeping units were provided additional specialized training to workers on how to clean and disinfect efficiently and effectively, with a focus on viral control. This, we didn't really think about it, but possibly we can, again, the flu, pandemics, cold and stuff, we have better tools and techniques to clean our spaces. The workers are trained to be safer in handling spaces during these timeframes. So we may be able to provide that safe and healthy work environment moving forward if we, we continue to use those protocols, which, are kind of embedded. And again, UV systems used in our hospitals and our, applications in our outpatient, mist fogging with viral sites on, quick setup, and taking the people outside of the hazard and letting that technology and that product work its magic and, fill a space, settle, and render it, virally controlled for a period of time, were great new additions to what we currently do. And we have that equipment, and we will continue to use that as we move forward and file applications for it. I mean, again, moving forward, the air handling units, we know where to upgrade. We know what the efficiencies are, and we learned at how they can play an important role. So when we work with sustainability and collaborate with those teams, we can, reduce the amount of energy and make those systems run so much more effectively. And, we can keep our occupants more comfortable as well. And so again, keeping that upgrade and that conversation, collaboration, partnership moving to keep the continuous improvement in those systems is key, moving forward. And we definitely learned that lesson during the pandemic. And again, like I mentioned, the new equipment and cleaning techniques are very, very important to, be very efficient. They're cost effective. And again, they keep our workers out of harm's way. We still need them to set up, but it's just much more safer for them, and how they use that application hands-free, in those different configurations was really a positive. Okay. So kind of wanted to, wrap up and then talk about, business practices moving forward. So, obviously emergency management, was brought in to organize all these communications during the pandemic. They set up a command structure to inform and regularly brief and communicate to university representatives, the general populace, had large scale meetings that worked efficiently. They were very well organized, documented, and that was a continuous improvement throughout the pandemic. They developed guidance for each individual spaces termed annexes. And these were used to, place signage, develop occupant or relay occupant capacities, sanitizing supplies, health and safety, personal protection, specific health guidelines per space category. So individuals could get that direct information and set up their own spaces. So these were all very clear and concise communications that ended up working really well, and provided dialogue and partnership directly with those folks using them, so they could get their questions answered and get improvements needed to their spaces. They developed, we developed process and protocols for supply chain to distribute through campuses. These are new ways to utilize our business partners and IT to gather information on needs and quickly distribute those supplies. As you can see, this is a model for distribution of goods and services throughout campus, and how we can make changes to make those more efficient. So, emergency management, follows this cycle. They ended up providing a restore order when we decided to come back full time. The function, was very synonymous with other cycles, but going through, their cycles, they have an emergency response planning, training, and exercise. They mount an effective response. They gather communications, they mitigate and stabilize the best they can while informing, and then they start focusing on what changes, we need to do to the facility process or business recovery in the meantime. And and then finally they want, you return to normal operations with these changes made with the improvements. And, inevitably, this is kind of synonymous with a lot of business function cycles. And I kind of want to highlight Dr. Deming with the PDCA cycle, which I'm sure a lot of you are familiar with the Plan, Do, Check, Act. And, I feel like, what we learn from this emergency management structure, we should, continue to do. Continuous improvement at our campuses, we need to continually plan events, operations, how we do our business. We need to set up action items to do those and carry out those plans, so we can do that. Check them, test them, get data and feedback on how they're doing. And then finally, the act, make changes and keep doing those cycles for continuous improvement. And I think, that is the major theme that we learned, is we can work together and collaborate to make our universities better and stronger and more efficient, and that ultimately helps out our faculty, educators, and our students to progress and have the best environment as they can, and whatever the future holds, whether it's online learning, hybrid learning, or fully in-person learning. We learn from our technology that our technology and our processes, we can constantly, continually improve on and use these lessons learned. So finally, in conclusion, everybody's coming off a very challenging and difficult time, whether you are on campus or kind of locked in off campus, grinding every day. We had major disruptions, loss of life, uncertainty was a common theme. But, I really believe that the focusing on that teamwork and the collaboration and how that made for these excellent positive outcomes, and for those relationships we made, we can continue on as we get back to normal life and make our campuses better, make our units better. So really excited about the years to come in a positive mindset. So again, that is all I had. So thank you for listening. I will go ahead and open up for any questions, comments, or other insights that you learned at your facility. Please feel free, if you're comfortable, to ask questions or make comments. We'd love to hear them and discuss.
Currently, there's nothing in the chat yet, so people can add or feel free to unmute if you have a question. The only question I have is about the AIA number. It should be in the chat if you pull it up. There, put it in again.
Yeah, Kristen got it loaded in there. Thank you, Kristen.
Well, I'll kind of give another call. Any questions, any other comments? If anyone wants to throw those in. If not, I'll give it a few more seconds. If not, I'd like to thank Scott for this informative session and being part of today's event. Remember that all these sessions are recorded and they'll be available to view through October 31. So if you have any questions, please reach out to the APA staff at education@apa.org. One last call for questions. If not, I think that's all we have for today, unless Scott has anything more to add.
No, thank you for participating, everybody. Enjoy the rest of the summit as it wraps up, and look forward to participating and collaborating. And APA really appreciate the organization and all that they do and the information that they have. So thank you very much, everyone.
Thank you.